Welcome to the Authentic Voice podcast. Today, I have the great pleasure of introducing Susan Gessner, who is a licensed psychotherapist with over 30 years of experience as a practicing clinician. Welcome, Susan. Thanks so much for being here.
Thank you. I'm glad to be here. Thanks for having me.
Yeah, so we're going to jump into some very interesting topics today. I know you maintain a private practice here in Charlotte, North Carolina,
Mhm.
where you work exclusively with adults. And a little background on Susan. You were originally from New Orleans. You went to school at Tulane. Um, and you really specialize in treating patients with trauma and eating disorders. So let's talk a little bit about that first, if you don't mind.
Yeah, absolutely. I was educated at Tulane and I did my internship at a renowned institute in New Orleans for trauma and eating disorders. And so that's really where I cut my teeth on trauma related mental illness, eating disorder treatment. And I probably worked, it's an inpatient facility. So I spent, after my internship, I was hired on and probably worked there for about 10, give or take 10 years with that population. So, of course, I became specialized in it and brought that to my private practice when I moved to Charlotte.
Wonderful.
Um,
And can you tell us a little bit about beginning to work with patients who have childhood trauma so we can kind of address that for our listeners as well?
yeah, the way I think about, I mean, there's all kinds of trauma, right? And so I really work with patients that suffer from interpersonal psychospiritual trauma. And so, there's a category of early childhood complex PTSD 0 to 5, when there's abuse, neglect, sexual trauma, versus a trauma that happens later in life, early adulthood, later in adulthood. And so I really specialize with that early trauma that happens in childhood, um, which in my opinion, it's a different set of issues. Sometimes, like if someone was traumatized by a car accident when they were in their 30s, or something like that, like a single episode incident.
Okay. And tell us a little bit about, I know very little about eating disorders specifically. Um, are eating disorders sometimes as a result or a symptom of early childhood trauma?
Yeah, yes. I mean, yes, early childhood, adolescence, eating disorders are typically a symptom to self-soothe and to really help someone disassociate, disconnect from really disruptive feelings. Of course, people that have trauma are mostly live in a fight or flight situation most of the time. And so they're always seeking behaviors or things to help them soothe that or disconnect from that dysregulation. And eating disorders are definitely a symptom of that. You
Okay.
know,
So,
as is like depression, some depressive, if it's not endogenous depression, which is a type of depression that comes from like a chemically something in your brain that's not firing correctly. If it's exogenous, which is as a result of trauma or other some kind of wound, then depression, anxiety are symptoms of that as well, of a traumatic wound.
okay. So it sounds like um depression, anxiety, and then eating disorders are all kind of things that bubble up to the surface, but the
Yeah,
root cause could be similar, right?
yeah, Yes, yes. As far as root cause trauma defined as, anything that happens that's just way out of the ordinary for people to experience. And so, again, eating disorders, depression, anxiety, OCD, substance abuse, cutting, the list can go on, right? I don't want to limit it here, but it's a lot of ways people will find to self-soothe that central nervous system.
Okay.
Sleep disorders, yeah.
Sleep disorders too. Wow.
Yeah.
Yeah, absolutely. Thanks for articulating that for us. And so I want to talk today, in particular about the emergence of psychedelic substances in a medical context, uh,
Right.
in uh, medically exploring those substances in order to treat long-term trauma. So, how did you first become interested in the research behind that concept?
Psychedelic assisted therapy is a really exciting and emerging field. And so, for someone in my field, the research studies are surfacing, they're abundant, the trainings. Um, and so, I just, anything that's going to help patients not suffer and heal appeals to me, right? And so I'm a voracious reader of anything new, especially I've done several trainings on psychedelic assisted therapy. And it's a really exciting field because people are getting relief. What we're finding is that sometimes people are medication resistant, they can do so much in talk therapy, but they still have this relenting sense of doom and dread and difficult symptoms that they deal with on a daily basis as a result of trauma. And somehow the use of psychedelics is really helping to heal parts of the brain that medication and therapy just can't reach.
Wow, that's really interesting.
Right.
So, so when we talk about um, you as a medical professional, can you help us define what medication resistant means and what that looks like and how you see that manifest?
So, the typical psychotropics that are given to people that present with depression and anxiety just don't really have a therapeutic benefit in that they have a complete cessation of symptoms, right? Like they, they will still experience catastrophic thinking, they will still experience intrusive thoughts about traumatic incidents that have happened to them or wounds that they've suffered at people that have hurt them that were supposed to love them. That's probably the most damaging type of trauma, is that when people are hurt by other people. And so, they might have some benefit, but it's just not, it doesn't get them to a place of peace and safety and well-being that we've seen emerging from the use of psychedelics, ketamine in particular, because that's FDA approved right now. And so we're reading a lot about the research coming out on ketamine assisted therapy, because that's being used abundantly right now for people. And
Okay.
so,
So what you're saying is very interesting because, mental health issues can be so overwhelming when you are like me, a person who struggles with depression and anxiety and having PTSD like symptoms. It really is difficult to kind of discern your feelings at times. And so when you describe um, being able to experience peace and serenity, then I definitely can see how that helps our listeners and people like me to kind of identify, well, maybe I am living in a little bit of a fishbowl. Maybe I still feel stressed all the times, or I still have negative thoughts about myself all the time, or those kinds of things, right? Uh,
Right. And so what we're seeing is that those things are getting dialed way down after someone goes through a series of, let's talk about ketamine, because that's being used a lot and that's FDA approved. That when they go through the treatment, the course of treatment, they are that that sense of dread or that kind of hypervigilance they live in, or that fight or flight, it's just abated. It's just it's dialed way down, and they can function and they can have thoughts that are positive, and they can still recognize that their trauma and their history is still there, but it doesn't take up a ton of space in their brain. And
okay.
and so the neurochemistry around that, I think we need to talk about a little bit, is that they're finding that ketamine is working on parts of the brain, and really in a neuroplasticity and a neurogenesis kind of way, like it is restructuring parts of the brain, and neurotransmitters are firing differently, and people are getting relief. And so those are things that psychotropic meds can't really get to, and talk therapy cannot really get to, the
Okay.
way you're seeing that happen with ketamine. And again, I'm in a micro dose. Like, this is not the kind of ketamine therapy where people are getting like psychedelic doses. They're getting micro doses, and they're going through a series of treatments, typically therapist led, with intention and goals, but it is opening up the psyche in a way that is allowing for really deep healing that seems to last.
So the concept of neuroplasticity is really interesting to me, because you're essentially talking about kind of redefining the brain works like a
Yeah,
faulty circuit board in a computer.
yeah.
And so what you've noticed is the psychotropic drugs, which, let's define that real quick, are in what category specifically that can't
Well, let's
necessarily
talk
do that?
about the selective serotonin uptake reinhibitor, the SSRIs, the mostly probably, there are probably a few drugs that are treating bipolar that can possibly have that somewhat of the same effect. I mean, again, I'm not a psychiatrist, so I defer everyone to their own medical professionals. But you know, typically people that aren't responding well, the widely used drugs for depression and anxiety, the SSRI group,
All right. So
are well. And they're also finding, everybody with a mood disorder has a sleep disorder, right? I've never seen someone that doesn't present with sleep disruption. And they're finding that ketamine's working in part of the brain that corrects the sleep disorder. And so it's really helping with sleep as well. And
wow.
so healing the brain in ways that that is long-standing. And I must say that when people go through trauma, because typically it's ongoing for a lot of people for several years, say childhood, the endorphin system in the brain gets dysregulated. And what do endorphins do? They bring a sense of safety and protection, and like a warm blanket over you, right? And so what they're finding with some of these psychedelic assisted treatments is that it's regenerating the endorphin system. And so people are coming out of that treatment feeling safe and secure and at peace.
So what you're describing is huge. I mean, feeling, somebody who's living in fight or flight all the time, who's
Mhm.
constantly has a nervous system that's on the fritz, being able to experience peace and serenity on a regular basis, like that becoming their new normal, and also the capacity for someone who has long-term problems with insomnia and sleep disorders being able to really kind of rewire their brain to sleep peacefully again. I mean, those are life-changing results.
Yeah, it's been life-changing. I have several patients that I've worked with for a very long time that have recently undergone ketamine therapy, and it has been life-changing for them. And it's almost hard for them to put into words what they experience. Um, what what they can really articulate is that they're just they just have a different awareness of what they experienced as it relates to their trauma. Like they have different clarity, insight, and a sense of well-being, and that they're going to be okay, and
Wow.
that they move forward. Um, I will tell you that patients have a very difficult time articulating what they're feeling when they come in and present with a trauma history, because they do live in either fight or flight, or they're living in a dissociative kind of place to self-protect. So it's very hard for them to put that into words. And when they go under this therapy, it opens up their psyche in a way that brings them to really deep levels where they can finally put words to things. So it's diagnostic in that way too, as far as like what really did they experience,
Wow.
if that's clear, for
Well,
people that.
that's incredible. And so now that ketamine has been FDA approved for a little while now, if someone is listening to this podcast and they're interested in this, where does that person start? What kind of provider do they talk to?
There are several clinics around Charlotte that are doing it, psychiatrically managed. I mean, every person needs to be um, evaluated extremely carefully. There are some contraindications for people undergoing this treatment, and so that needs to be carefully evaluated for safety. But yeah, I would start with my doctor first and foremost to discuss it. I mean, every doctor is fairly aware of that this is going on. Um, and and then there's referrals. I think Novant has several clinics. I have to say that there are some online services. What I really like is when someone is in the room with a patient, helping them assist in that therapy with ketamine in person. I think the energy of a therapist and a patient together going through that is very important. I think the online stuff can be beneficial if someone doesn't have access to that available, to be with a therapist in person. But being with a therapist in a assisted led kind of treatment course of ketamine would be my absolute first choice.
Okay. So let's talk about that because um, as someone who has undergone depression, anxiety, insomnia, PTSD symptoms for many years, a simple Google search told me that there are places where you can just go and put your credit card number in and get ketamine shipped to your house.
Right.
Right? So, so that's an option for people, but I want to highlight two things that you said. Number one, ketamine isn't for everybody,
Right.
which is why you should absolutely be evaluated by a medical professional first.
So can I just make a comment about that while
Yeah.
you brought it up? So
Yeah.
what we are seeing with when it really is contraindicated as far as emotional disorders, ketamine, I mean, ketamine was initially used as, I mean, it's an anesthetic. I mean, it's been anesthesia for 50 years, right? So it has depersonalizing aspects to it. And so someone say with a personality disorder, say borderline personality, that has a fragmented sense of self already, to do ketamine could be extremely agitating because they already feel somewhat depersonalized. And so that would not be a good thing. You know, that would be a very agitated state. I can't wait for this to stop. I just want to be back in my body. I mean, that kind of situation would make their symptoms worse.
Okay.
And so that again highlights I can't stress enough that you have to be carefully evaluated by a psychiatrist and your therapist. And, you know, this is not something you just kind of go do impulsively.
Okay, so that's super important. And then thank you for expanding on that. And then the second thing that you said that I think is really important that I want to highlight is um, your medical opinion as a professional is that it is best used in the company of and under the supervision of a licensed therapist in a certain environment, not just on your couch when you ordered it off the internet, right? um so that's really, really important, so thank you for articulating that.
Yeah, and sometimes, you know, to expand on that, when people go through trauma, it's sometimes it's a very isolating, solitary event for them, and no one is there with them that witnessed what they experienced. And so I think it's very important to have a compassionate person with you as you're experiencing wherever you're going in that treatment and whatever's coming up for you, in helping you process that, you know, in just like someone is in the room with you that really cares about you and what your experience is. And also, you know, to just help guide in the most therapeutic way possible.
Okay,
I
so
think it's the most healing.
that's another really important point is um, if you are being treated with ketamine and you have some really intense memories or emotions come up, if you have a therapist there with you, they know exactly how to guide you, how to soothe you if necessary, and how to help you through that and hold your hand through that experience, right?
Right. Yes. Absolutely.
So, so let's talk about some other kinds of psychedelics that are being used for trauma recovery. Uh,
Okay.
how are things evolving and moving in terms of psilocybin research for mental health specifically?
I think the two that they're really doing a lot of research on and clinical trials is MDMA and psilocybin. So for people that don't know what MDMA is, it's methylene methamphetamine. So it's in the amphetamine family, and it works on, you know, neurochemically, it's working on serotonin, dopamine, oxytocin, and so it's, you know, they're looking at that especially for, I mean, you can imagine with serotonin, dopamine, oxytocin, all of the feel good chemicals in your brain. And when that's getting flooded, it's opening up the heart and love and trust and it's looking like it could be amazing for trauma healing, especially attachment disorders and shame-based trauma. And so again, though, it's an amphetamine family, and so there's going to be contraindications with cardiovascular patients, hypertension patients, anyone with any kind of stroke risk, and so you would have to be very carefully vetted on that. And also, if someone's on serotonin meds, that's going to be a problem because it kind of hits the serotonin in a big way. And so can't stress enough again why a doctor and evaluation and really being carefully evaluated is important. But they use it, they've used it a lot with couples, and because of trust, and it dials down fear and boosts trust when they're looking at those trials. So it would be a good fit for a lot of people.
Okay.
And so that's emerging, and that's very exciting. And then of course, psilocybin, they're doing research on that too, and finding that again, another way to really help people heal in kind of a connecting to the universe, connecting to consciousness. I'm not just here by myself, I'm one of the whole thing, and not feeling so alone in the world. I've read some studies where they're using it with end of life, so people don't feel so alone and so afraid that they're just by themselves in that journey, because it's got this quality of an interconnectedness to the earth, to the universe, that kind of level of thinking.
Okay. So, and I know psilocybin has recently become medically available in a couple of different places. And it's so taboo, and we have so many different connections and associations and stigma around these substances. So I want to talk about the dark side of these substances, since you're the medical professional and you're following the research, and obviously you take being a medical provider very seriously, and the health of your patients. As a young person who was extremely distressed, had severe depression and anxiety, I turned to heavy drugs at a young age because I didn't have therapy, and I didn't have access to an SSRI, and I didn't have any kind of mental and emotional health guidance, right? So my experience of MDMA was as a club drug.
Right.
And in that context, it can be really dangerous, when you
Yeah.
have when you're I'm aging myself here, but when you go to a rave and people are selling MDMA on the street, number one, you don't always know what's in those drugs. Number two, you haven't been evaluated. Number three, you are usually using those drugs in a really crazy context and environment, not supervised, not regulated in any sort of way. And I had an experience of, feeling that deep love, trust sensation in the wrong context with the wrong people, right?
Right.
And then, being with a bunch of people who were throwing caution to the wind and making bad choices. And also, very unfortunately, I had the experience of what happens when you take too much MDMA, and it
Right.
drains your serotonin, and then you might
Right.
go through an even worse depression. So
Right.
I want to talk about that just a little bit.
Yeah, and so, the therapeutic intervention around psychedelics is very dose dependent, right? So it's not just using it recreationally. I mean, the doses are very vetted and evaluated and for what the need is of the patient and managed by a medical doctor, a psychiatrist for those reasons, because they are working on parts of your brain with other chemicals. And also if you're taking any other drugs, I mean, what they've seen that some of these psychedelics are not indicated if someone is a heavy THC user or opioid user. You know what I mean? Like, so everything just needs to be really carefully vetted. I mean, people can have a really bad trip. I mean,
Yeah.
that happened, when people abused it, or like you said, to your point, opening up parts of yourself to maybe not safe people or wrong people or the wrong people. And I think you also have to be careful therapeutically, even when you're working with a therapist, like they have to be very aware of the boundary system and anything that a patient going under that kind of treatment would transfer on to the therapist, so to speak.
So once again, what I'm hearing you say is evaluation is extremely important. Context is very important. Dosage and supervision can make a world of difference, right?
Yes, and the patients that I have that have undergone this therapy, I've worked with for years. I mean, we've done a lot of trauma work already. And so they were not in dysregulated states when they underwent ketamine therapy. And they probably had done as much work as they were going to be able to do in therapy. And the way I see their ketamine therapy is it pushed them into a new level of healing that they were ready for.
So that's a really important point too, is if you have just realized that you've been suffering from childhood trauma, or that you've just discovered some unresolved trauma, which is usually how it works, is you kind of discover this Pandora's box and then you slowly open the lid. If you're at that stage in your healing journey, this probably isn't the time to explore those options, right?
Right. Or to just be very careful with how you're exploring it and to ask all the questions and to do your own research on it so you have the questions.
I mean, wouldn't you say that it's a bit maybe a bit impulsive to go seeking kind of a chemical solution when you don't fully understand the source of your trauma yet?
Yes.
Okay. Yeah.
Yes. And I think people who have trauma need to do some work with a therapist, a trauma therapist specialized, that knows how to do that work with them, because it can be highly dysregulating to even start the work.
Yeah. Yeah. I mean, for me, it was like, riding a tidal wave. And I was so glad at the way I first approached behavioral therapy and doing talk therapy for a long time was, I reached out to my primary care first. And he recommended behavioral therapy and also an SSRI, so that I had this really comprehensive support system and support plan of how to kind of use all these different sources while I was opening the lid to my Pandora's box, right? Which I feel like a lot of people don't have that in the beginning.
Right. And that's so important to have a comprehensive plan. And you know, I will say, I mean, I have read studies and know of other patients, not my patients, that are vegetatively depressed. So the definition of that is you really cannot get up off the couch, you can't get out of bed, you can't take a shower, you really just are not functioning very well at all, that have gone in and done ketamine therapy and a treatment series, and that vegetative quality of the depression has started to decrease big time. So, you know, it's not like a one size fits all either. Like there's definitely multiple uses for it, multiple treatment plans versus how many you do, maintenance schedules, all of that kind of thing. Again, I just can't stress enough that you just have to be carefully evaluated to see if you're the right candidate, to see if you feel comfortable. I would not recommend anyone undergo treatment like that if they're not completely on board and feel comfortable doing that.
Okay, so if somebody is kind of on the fence,
Right.
don't run out and go do it anyway, right?
No. And you know, because you want it, and I would say the same thing if someone was on the fence with taking medication. Like they might need a little more education, they might need a little more time, because ultimately you want the most success for your patient.
Absolutely. Well, Susan Gessner, I so appreciate you being here today and sharing all of your wisdom and insight and professional experience with our listeners.
Thank you, Grace. It was a pleasure, and it's such an exciting field. So I hope it helped people learn more about what's out there. Alternative approaches to therapy are a great thing to have, to treatment.
We'll have to
Yeah.
do a follow-up interview a year from now to
Yes.
update where the legislation has taken us.
Yeah, well, absolutely, because absolutely. And what states are doing what. And I'm pretty impressed that North Carolina is doing ketamine therapy.
Well, thank you so
Okay,
much, Susan.
thank you. Bye.